Great. So I will sort of talk about the use of community advisory boards. I actually wasn't intending to develop slides, but I couldn't remember how I used my community advisory board since it's been so many years. But the purpose of my study was to understand more about barriers and benefits related to PrEP with African American girls, as well as in their perceptions around, their parents' perceptions around parental consent. So, parental permission. So what was interesting about this project is I used a convenient sample of an existing intervention with moms and daughters. So that was already in place. So that actually made recruitment much easier. But I did do a community advisory board in the beginning. I wanted to, of course, this was about PrEP. So part of what we decided is we have to make sure that we properly explain and develop some sort of educational module that explains PrEP to the participants before we have a conversation about it. So, that's something that happens a lot in the research ethics world when we want to understand what people's thoughts would be about utilizing a certain technology or a product or a drug or a medication. So this is kind of what my study did with PrEP. So I utilized two existing boards. And I think part of that was I had some delays with getting my IRB approved. And I wanted to make sure that I had enough time to complete my study. So I was at the University of Illinois at Chicago at the time, an existing community engagement advisory board. So a lot of people in institutions that have CCTS. Does anyone ever have like an existing CAB at their institution? I don't think this is unique. Oh, you do? Okay. And what is it connected to? Okay, I don't know.
The Center of Biomedical at the COBRA.
Okay.
Is a standing community advisory board for substance use studies.
Okay.
That's available to all the investigators.
Yeah. I mean, I know for sometimes Centers for Age Research might have an existing. WISE, the Women's Interagency HIV Study, also has an existing community advisory board. So sometimes you just have to ask. I'm sure, Cynthia, you're familiar with, you're shaking your head.
It is, yeah, WISE. Yeah.
Yeah, WISE, yeah. That's the one that I know about. So I used CAB. It was actually a great interdisciplinary group of people. So it wasn't the study participants that sometimes are potential target population or people with characteristics or demographics similar to the target population. So this was community leaders. We also, Jerry Donnenberg was PI of Community Outreach Intervention Projects. This is also an HIV drug use project, and there was also an existing community advisory board. So these are the two advisory boards that I utilized. And just to highlight, CAB provides interactive feedback. They provided a lot of great material. At first, I wasn't really sure. I'm not even sure if I was thinking about a video or some sort of module, but they helped me to really decide what the content should look like for PrEP. It was also nice learning from community leaders what they knew about PrEP before I actually developed this module or this tool that helps people to understand what PrEP is. So it was a good group of people. So what we really settled on in terms of the educational content, we talked about facts related to HIV and how PrEP worked, the side effects, different types of PrEP delivery. We wanted to ask people's ideas around, is there any type of delivery that you would prefer? We presented a hypothetical clinical trial for female adolescents. My GA at the time was a Black female and developed this really great module. And, I think it was nice to have that involvement as well, because she actually had some experience with technology, which is something that we were able to do this at a pretty low cost as well. And we talked about PrEP not yet approved for adolescents younger than 18 years at the time. So this is two examples of some of the module clips that I highlighted. But I wanted to just, think about, content. Some of the questions even were informed by the engagement of the Community Advisory Board, thinking about the health belief model, PrEP awareness, attitudes towards PrEP, barriers, perceived benefits, and susceptibility and risk. And these are, again, questions that were really helped the Community Advisory Board helped to inform. So this is a general overview, but I wanted to highlight two other pieces similar to Shira. This was my first sort of well, no, you had experience with cabs, but just given I hadn't actually developed a cab until I worked on this study a few years ago. And it's similar to the discussion that we had yesterday in terms of formative research and using cabs as part of formative research. And this was a stakeholder engagement project where we really wanted to adapt a sexual health intervention for younger Black adolescents. So I was a part of this team. I'm like, we definitely need a community advisory board. We need multiple ways to really adapt this sexual health curriculum. I think the interesting part is sometimes adaptation, there's not a lot of literature that really gives you a step-by-step process to really adapt. So I just highlight this to say that community advisory boards can serve as part of an iterative process. So this is a paper where we talked about soliciting and using an expert panel as well as a community advisory board to lead to the adaptation. So again, another way community advisory boards can be used in formative work and adaptation work, and this was about Black youth. So here, two community advisory boards with Black women. So the target population, we used facilitators, people who were facilitators for an ongoing intervention, and leaders as well. So this, again, it's not research, of course, but people that have experience with the population and helped us to really understand what are some things that we should focus on in adaptation. So this is another way that I've used community advisory boards. And I just wanted to show this final slide, just thinking about community advisory boards as part of a stakeholder engagement process. And I'm drawing from work by my colleague Yamali Molina, who wrote a really great paper that I'll include in my references about different ways of stakeholder engagement and thinking about the function of certain types of whether or not it's your study team that's helping you to develop something, or a community advisory board, or what are you using the focus group for? Sometimes we use theater testing when we're thinking about intervention. So just keeping in mind to be sure about the goal and the purpose, or how do you plan to use the people that you're working with. So what's the purpose of your CAB? Is it to develop some sort of educational module? Is it to inform your protocol or your study design? Just keeping all those things in mind, because that really influences the type of stakeholder that you need to carry out the work. So this is just one example of that. And focus groups were used very different than we used our community advisory board. So that is all. I'll stop there to give us time for conversation.